Hello, everybody, and I guess we're live. Welcome on board. Good morning, good afternoon, good evening from whichever part of the globe you are tuning in from. It's 3 p.m. here in bright and sunny Kuala Lumpur. My name is Rachel. I am the Communications Officer with the IFRC here in KL. So hello, welcome. I hope you all stay with us for the 30 minutes to 40 minutes that all of us are going to be talking. And the topic that we all are going to be discussing about today is migrants and the challenges they face with COVID-19 and getting vaccinated, especially now that vaccination programs are being rolled out worldwide. And we are going to be hearing from speakers across the Asia Pacific, specifically from the Maldives, Australia, and Philippines. This is a series, the Red Talk is a series that the IFRC has, and this is today's Red Talk is in conjunction with the launch of the Global Migration Lab COVID-19 report that was just launched yesterday. So we have 4 speakers for you today. So Inasha Ishi Abdullah is from the Maldivian Red Crescent. She's the head of Health and Inclusion Unit, and she oversees psychosocial programs and services, and she heavily supports the coordination of COVID-19 responses and vaccination registration with migrants. So she works directly with migrants, and that's Ishi for you. And we have Seema Varma from the Australian Red Cross with the Migration Support Program. She's been with Red Cross for 14 years, and she's also the operational lead for the Emergency Relief Program in response to COVID-19 in New South Wales and Canberra. We also from the Australian Red Cross is Vicky Moore. She is with the National Migration Lab, and she works closely with partners to ensure migrants are safe and get the support that they need. And last but not least, we have Nora from the Philippines. She is the lead researcher for this report. She led the Philippines' contribution to the IFRC Migration Lab. So I'm hoping that all of you would stay on and hear all these beautiful ladies speak. So let's jump in, shall we? I'm going to bring on Ishi from Maldives. Hi, Ishi. Welcome. Ishi, you are on mute. Could you please unmute?
Hi, Rachel. Thank you for having me here.
Okay. Yeah, no problem. So Ishi, what is the most understated obstacle that you have picked up upon in all your work with the migrants and your vaccination campaigns? What is the blind spot that we all we may not have noticed with challenges with the migrants in getting vaccinated and access?
Okay, so basically, we have been working in different areas of the vaccination program that we are running here. We are trying to disseminate information to create more awareness, and also we are trying to get them registered, especially the undocumented migrant workers here. And I think the biggest challenge that we are facing here is the language barrier. Like in every part of every step of the vaccination program that we are carrying out here, we are seeing that there is a huge language barrier, a gap there. Basically, the migrant workers here, they have very low literacy levels, and most of them, like we do have migrant workers from different countries, but our majority of the migrant workers working at Maldives are from Bangladesh. And while at the registration center, even when we are getting them registered for the vaccination, we find out that there is a huge difficulty in having a conversation with them. And when we are getting we asked them to come to the my vaccination center before getting vaccinated. So we had to uh, we have to help them filling up a consent form, which is required for the vaccination. Even during that important, like filling out that important form, we find out that they're like we have so much of trouble in having a conversation with them. Most of them do not understand, but it's such an important
Mm-hmm.
conversation that needs to be done, because we're asking a
Yes.
lot of important questions that could also
Mm-hmm.
put them at a risk there.
Mm-hmm.
Yeah, so I think even with disseminating information, even though we put up posters, most of them are not able to understand and read the information that is put out there.
Mm-hmm.
But uh, we do carry out audio messaging via lorry rounds around the capital city of Male, and we have done
Okay.
this in other islands in Maldives as well. Yeah, I think that is
Okay.
one of the main challenges here.
That is a good point. Language barriers. Besides, besides carrying out this, information, using vehicles and all that, what else can we do working around this, working around language barriers? Because, we cannot expect to immediately learn the language just to communicate with them so fast. That could take a lot of time. Is there another solution that we can work around immediately right now for, in terms of vaccination programs?
Yeah, we do have a few Bangladeshi and other migrant volunteers working with us at the vaccination
Uh-huh.
registration centers, and we are
Mm-hmm.
also seeking help from other blue collar and white collar
Mm-hmm.
migrant workers who are working in Maldives to get translations done, and also with we are also carrying we do conduct information sessions regarding the COVID-19 disease, and
Mm-hmm.
also on the vaccination process and about the COVID-19 vaccination. Yeah, so I think one way to address that would be seeking help from other national societies.
Mm-hmm. I see. Okay, that's actually a good solution. Getting the migrants themselves to volunteer, especially if you notice some of them, are eager to work, eager to volunteer, eager to just do something. Especially if they've lost their jobs and they have nothing to do all day, they can volunteer and help with the vaccination programs. Yeah, that's a very good. That's a very very good solution. Thank you, Ishi.
Thank
I'm
you.
just going to move on to Seema from Australia at this point. Hi, Seema.
Hi, Rachel.
Hi. So, Seema, I understand that you are also a migrant in Australia and you've been with the Red Cross for 14 years. That's a really long time. So, what is your personal experience from this? You might pick up certain things that nationals may not pick up. So, share with us.
Yep. Thanks, Rachel. Before I proceed, I would like to acknowledge the traditional custodians of the land from which I'm speaking today, and I pay my respects to the elders, past
Mhm,
and present, and the emerging leaders as well. Now, in response to your question, something what we have picked up is there were families who were functioning fine. They were employed and they had jobs. They were going on with their lives. Suddenly, COVID hit and they lost their employments. That put them into a situation where every day was kind of a choice. We had
mhm,
seen families where they had to make choice between buying formulas, nappies,
mhm,
or paying rent. So that's a very difficult choice. Like nobody would want to be in a situation like that. Whereas
yes.
when you have had a life, a reasonably comfortable life where you have been able to meet your basic needs.
Mhm,
Yeah, so that has been very challenging for us to see that.
mhm,
We have also seen where people have to make choice to either pay rent or pay school fees.
mhm.
So
So that's a day-to-day struggle.
that's a day-to-day circle.
Mhm.
Yes.
What could be an immediate solution, or what have the Red Cross been doing day to day just to combat this?
Well, day to day, we have been providing assistance to these clients when they come to us. We have been able to provide them some financial
Mhm,
assistance to
mhm,
be able to get through this and link them up with the services that are there. We have
mhm,
partnered. with services that are providing food hampers. So we have partnered with them, and we have been able to provide food. So it's about getting things from everywhere and trying to assist the clients. We've had some success stories as well.
Oh, okay. Do you have any success stories to share?
Yeah. I have one which comes to my mind straight away, and that client was
It's
really
great.
ecstatic, if I say that. And this client had lost a job, and she was a single mother, finding it hard. She was a migrant, and she was going on fine. But then, of course, it came to a point where she was not one of those who would seek help easily. And then she came to Red Cross. We provided her assistance. We provided her assistance for her daughter as well. And then she found a job, and she found a full-time job. And she was really thankful. And she was thankful for Red Cross to support her. And she sent us really lovely emails saying, that she cannot forget, and she wanted to volunteer with us. So that has
Oh,
been
that's good.
uh, yeah, so that has been, when you get such stories and see the outcome, the direct impact of your work,
Mm-hmm.
that motivates
Mm-hmm.
you. Yeah.
Mm-hmm. So besides providing, say, essential items and food and all that, do you think searching for jobs, or at least part-time jobs, could be something the Red Cross does?
Yeah, we do that
Besides encouraging them to volunteer, so
mm,
you do help them to find jobs,
yes,
or these
where
part-time jobs?
where it's possible, where it has been, that situation changed. There was, due to lockdowns, the frequent lockdowns that we were
Mm-hmm.
experiencing, it hit those industries hard, where mostly migrants were working, the hospitality industry, the retail sector,
Mm-hmm.
or the food industry. And it has been slow to recover. It is recovering, but then it's hard to find the employment straight away and get into it. Yeah. But somebody who has got experience,
Mm-hmm.
they are able to find jobs. But I think in general the sense is that it hasn't picked up to the scale what people were getting
Mm-hmm.
before. So they're
Yes.
getting, let's say, casual employment, but not,
Mm-hmm.
whereas previously they might be on a contractual agreement. And yeah,
Mm-hmm.
so now it's like you're getting 1 day here, 2 days there. That's what we have been hearing from clients. Yes.
Okay, understand. Yeah, that's great. Okay. So thank you, Seema. I'll come
My
back to
pleasure.
you. Yeah, shortly. Let's go on to Vicky Moore, who is also with the Australian Red Cross. Hi, Vicky. Hi, Vicky. Can you hear me? Let's give Vicky a few minutes, shall we?
Sorry, it was a delayed reaction on my phone to take me off mute. Hi, Rachel.
No problem. Hi, Vicky. How are you today?
Good, thanks.
Okay. So why is it very important for everyone, including migrants, to get vaccinated? We know that nationals are part of all the responses and all the programs globally. We don't have a problem as nationals, but migrants, they don't mean to be excluded. The programs are not designed to exclude the migrants. It's just something that happened. It's an unfortunate thing that happens, especially undocumented migrants. Why is it important for even the undocumented migrants to be included in these vaccination programs?
Yeah, it's a great question. And I think, as we all know, moving to the next stage of the pandemic where we're looking at vaccination, it's progressed in some situations more than others. It's so important, and we would see it as a humanitarian imperative to actually make sure that everyone has access to a free vaccine regardless of visa status. So as you point out, undocumented migrants or irregular migrants are just as in need of getting the vaccination as anyone else, unless we're all working together to make sure that we get as much coverage as possible in terms of the vaccination, the virus won't go away. So it's really one of those situations where as a colleague of mine was saying, it's not about us and them in terms of migrants and nationals. It's actually about all of us and the virus and how we actually respond to that, and how we make sure that it stops circulating, it doesn't mutate, and we're able to start that step into recovery. And because of that, there are certain parts of, especially people who are undocumented or irregular, they may not have access to information. They may be particularly vulnerable to things like exploitation. They might be really excluded from the broader community. So it's really important, I think, that governments and community organisations understand that getting that message out in language often, but also in methods that people understand, in methods, as Sima was saying earlier, that community leaders want to share, in ways in which people are already communicating that might not be mainstream media, for example. It's really important to work with those communities and understand how to communicate, because one thing is obviously changing the policy and making sure there's access to vaccinations. And then it's another thing to make sure that people understand that even if they don't have the right visa status, even if they don't have access to the public healthcare system, that they can still get vaccinated. And I think it's particularly important. I mean, I know 30% of the Australian clients that we surveyed for the Migration Lab report talked about fear as being a factor in why they didn't want to come forward for healthcare, for example, or other supports.
Okay.
So we really need to be mindful of that impact that it has on people who might fear deportation, they might fear detention, they might fear being in contravention of a visa requirement that says don't come to the state health system. It's really important that we actually look into all of that and make sure it's safe and that it's a process where they can come forward and get vaccinated for the good of the entire community without putting their own safety at risk.
So, yes,
and I was just going to say on that, Rachel, I was just going to say that in terms of, sometimes it is by design and sometimes it's by accident. And I think that's a really good point with this in particular, that we just urge kind of governments and people to lift their gaze and remember that it's not just about citizens and permanent residents and formal visa holders, that there is this population that we need to work with. And we've already seen quite a few governments coming forward. So in Colombia, for example, they've just recently announced a plan to actually provide formal visas to all of the Venezuelan refugees and migrants within their country, which includes access to employment, and includes access to health, and it includes being part of the vaccination campaign. We see in the region, in Malaysia, for example, I think the government's announced that it'll extend that free vaccination program to all foreigners, including refugees and undocumented migrants. So we are seeing that, I think, once governments are aware of some of those challenges, that absolutely they can step forward, because it's a real public health imperative around making sure everyone's vaccinated. So there's good practices out there that we can amplify and share.
And that we can mimic as well in our own respective work.
Absolutely.
Yeah. Could these structures, systems, or programs be designed, continuously improved and designed to, say, mimic say some sort of a whistleblower structure where they can, it's a protected space where their identities won't be shared, and these undocumented migrants can be safe from fear and to come in and specifically, yes, get vaccinated. For now, I mean, right now in this climate, this whistleblower structure is just for getting vaccinated. But of course, this can be, for further future endeavors and all that. Do you think that could be possible?
Look, I think there's lots of different ways that different countries will approach it. So obviously that aspect of regularization is one that's much more sustainable, because it's about providing people access to other supports, not just the vaccination. But there's also ways of making sure that the data that's being collected is very conscious of the impact data can have, and making sure that there are data collection methods in place that don't put people at risk, for example. There are lots of different ways of engaging. There's also the ability to have a vaccination process that doesn't require necessarily that identification. So there's lots of different ways of doing it, and I think it's going to be quite different in each context. But I think one of the really important things is just to go back to some of those other barriers as well, around even if we do make it accessible. Excuse my partner in the background. He's just brought me dinner.
Okay.
So being really mindful of issues like digital literacy with some of those communities that aren't as well connected, being mindful of things like being able to seek support and inconsistent application of the policies. So for example, we're concerned you might have a position where the government might say absolutely anyone can have access to a vaccine, but someone at the local level might not be aware of that. So someone at the local level doing the vaccine may be saying, unless I can see your residency card, I can't do it. So it's much more than just changing a policy. It's about everything that sits around that to make sure that access is dignified and sustainable and open for everyone, regardless of visa status.
Yes, that's true. Thank you so much, Vicky. That was very insightful. I'll come back to you shortly. Can I go to Ishi right now from the Maldives?
Hi.
Hi, Ishi. Thank you so much for waiting and waiting patiently. So listening to Vicky, she had some really good points. What really struck me was something she said about digital literacy. That this could be, what do you think of having these short courses, short programs that migrants can take up for free or for work, just to very much like digital literacy, and is there any other programs that could educate migrants, in what areas, in certain areas, what other areas can we educate them just so that they become very invaluable to the community and to these, to the vaccination programs?
Okay, to first of all start with the digital literacy aspect of it, I would say it would be a bit challenging here in Maldives. Like I mentioned before, the majority of the hello, can you hear me?
Yes, I can hear you.
Okay, the majority of the migrant workers working here are not very the literacy levels are very low, and they do not have access to these digital platforms. They are not very familiar with the social media and other digital areas. So I do not think that would be very functional here, but as for the more developed countries or more developed areas of the world, I think that could work. But within Maldives, among the blue collar and white collar migrant workers, I think that could be an area where we could maybe explore. I think there are people who are very interested in these areas. Yeah.
Oh, have they verbally told you that they are interested? Is there something that they said, they personally come and told you, I'm interested in this part,
I've met with a few migrant volunteers who are working with us, and they are very keen on taking up the opportunity in every aspect of the response. They have been going to assessments with us. They have been also at the front providing information, and they have also been taking up sessions. And there are people who are working as lecturers, doctors, who are also working with the translations and all. So yeah, I think there is an opportunity, but there is also a barrier here because most of them are working full time, and they have very limited time to work and come and work with us on these areas, especially with returning to the new normal, back to work. Yeah.
Okay. What would you personally like to see happen in the near future with your vaccination programs? Is there an area where, just what would you like to see happen in
Okay.
Maldives specifically? Yeah.
Yeah, I think we just started recently, and I think it's only 3 weeks after we started the vaccination registration, and we have only registered around 2,000 people for the vaccine, and I think we've only vaccinated a few of them, only around 200 to 300 undocumented migrant volunteers. So there is a lot of work that needs to be done. I want to see that the whole vaccination campaign being rolled out throughout the Maldives. Maldives is a very geographically dispersed country, and so we have challenges in reaching out to the most vulnerable groups who are in the most isolated areas across the country, and also so it would be a challenge, but I would like to see this being rolled out and to see more people get vaccinated and more people getting registered for the vaccination. Yeah.
Okay, thank you. Thank you very much, Ishi. Is there anything else you'd like to share with me, a personal story or even from the Red Cross, Maldivian Red Crescent perspective?
Yeah, there is a lot of stories that I could share, but there is so much of I couldn't. Would you like me to share a story of?
Yes, please. Any story would do. Some,
Okay.
Yeah, these
Yeah,
personal stories are very valuable. Yeah.
Okay, so when I first went to, during it was right after the lockdown, we went to do an assessment to understand the living situation of the migrants, and also to have a better understanding of the of access to healthcare. And we went to migrant where a location where a lot of migrants were living. Over 200 migrants were living in this labor quarter, and it was such a, they were living in very poor conditions. They did not have proper access to water. They did not have very sanitary, very hygienic shower facilities. They did not have proper access to food. They were just it was so hard to grasp and understand. Like, I know that this was happening even before the COVID pandemic, but then again, I think we kind of had to face, even as a country, even as a national society, we had to actually face these things, and we had to. Yeah, so I met a few of the migrants who were living at the at the labor quarter, and they were
Yeah.
sharing stories, saying that they were here to actually get an income and to support their families, but during this situation they're actually getting help from the families back at home. It was such
Mhm.
a, it was such a sad moment for me too. And they
Mhm.
were asking me how we were going to provide help, and they feel that
Mhm.
they are kind of neglected and they are
Mhm.
very discriminated. I don't know. It was
Yeah.
a very
Yeah.
emotional moment for me as well.
Yeah, that's what we were talking about, Vicky, earlier. These programs, these vaccination programs, they're not designed to exclude the migrants, but it's sort of a natural thing that happens because the nationals are given priority first. And on top of having, on top of loss of income and loss of livelihood, um, yes, they do feel the discrimination that they feel is real. And yeah, hopefully we at the Red Cross can work towards even, reducing discrimination when it comes to even providing essential relief, and basic healthcare services. Yeah, so thank you, Ishi, very much.
Thank
I'll
you.
come back to you later. Thank you very much for patiently waiting. Um, yes, can we go to Seema at this point? Yes. Hi, Seema. Thank you for patiently waiting. How are you?
I'm good, thanks, Rachel. How are you?
Okay. So, in a nutshell, what can we do? We do know that there are overarching policies in place for these migrants, policies and, what governments can do. But what can authorities do? Because they are the ones authorities and volunteers and aid workers, because they are the ones who do deal with migrants day to day. What can we do now, right now, that could even affect a handful of migrants every day? Even here in Malaysia, and as you know, Malaysia, we have a large number of undocumented migrants, and that was an issue initially when COVID-19 hit. And now that vaccines are here, it is continuing to be a very large issue. So what can these frontliners do day to day, that even if it positively affects the migrants there?
I think if you're talking in terms of providing aid, then
Mhm.
that is something that we have been doing
Yes.
regularly. The caseworkers have
Yes.
been doing, patiently listening
Hmm.
to
Hmm.
the clients when they're coming to us and talking about their
Hmm.
stories. And it's about, being there, being available to validate that the experiences that the clients have, the migrants have. And in terms of I'm kind of blessed in a way that we work in a sector which is very, in New South Wales, we have a collaborative sector, and we are providing support to clients in that way when it comes to people seeking asylum. And in terms of temporary visa holders, also, which are people seeking asylum are also temporary visa holders, it's about, okay, if what are their skills, and just asking them, have they tried various platforms to find employment, and have they, how it has been, and being able to guide them through what is available, because sometimes there's so much out there, so much information, that
Yes.
it's hard to take it on. And it's about just being able to guide them and support them in terms of aid. If you talk, if it's about vaccination, something that came to my mind was that, look, I'm a migrant, I'm part of different platforms, social
Yes.
platforms, and what came to my mind was that it would be, going out to those platforms and try and engage with the community members through those platforms, and also through the community-based organizations and the community leaders, and explaining them that what is this vaccine, how can you get that vaccine. And even then, if one of the last thing that could be done is that having these vaccinations at the centers which are closer to their familiar areas, because that will, if you have it in a hospital, then somebody who's undocumented might be scared to go to hospital, and if you see security guards standing outside, then that's another barrier, because I know when I had went for COVID testing, it was all in English. Imagine, I found it difficult to navigate where I have to go, and you're already worried, you're already scared whether you have got it or not, and then when you're trying to navigate yourself. So yeah, it's about that, how we can make it easy
Yes.
to
Yes.
access. Yeah, yeah,
And this is what Ishi was talking about earlier. Language is a huge barrier.
yeah.
Yeah, it's something that we have to deal, they have to deal with day to day. Yeah, that's true. Thank you so much, Seema, for that insight. So lastly, I would go to Vicky. Hi, Vicky. Hi.
Hi,
So I have
Olivia.
I have a last question for you. So this is an excerpt from the report that I read. Ensuring all migrants, irrespective of legal status, be included in responses and vaccination programs. So the phrase "irrespective of legal status" is repeated, is repeated in the report. Yeah, what can we do in terms of vaccination programs, vaccines, when it comes to irrespective of legal status?
Yeah, so I'd go back to what I was talking about further about firstly using examples of where governments have made changes and using those examples with our own governments. So to firstly address the policy barrier where people might not everyone might have access to the vaccine. And then I think secondly, it is about working in partnership with community. So as our colleagues have been saying, there's no one person that has all the answers, especially when it comes to outreach and language and understanding how people want to take in that information. And if you can imagine someone who might be undocumented or irregular, they might be living in informal circumstances, they might not speak the language of the country they're in, they may actually potentially be at risk of exploitation and very isolated. So we've got to think about how we communicate with that person, how we make sure that the communication that we send out is appropriate and tailored to how they take in information, and understand how we can improve from that. And then I think we need to make sure that we've educated all of our frontline workers so that when someone does present for that testing, they're not concerned about the visa status. They're concerned to make sure that as many people as possible in that country are vaccinated as part of the public health response, and that's their primary focus. So I think, they're three really critical things to be able to work together to make sure that our public health response and our road to recovery is actually faster and more comprehensive, making sure everyone's included.
Is there a key takeaway from the report? The report is, 50 pages long. Not everybody would have the chance to read the report. Is there one key takeaway from all your findings for the report that we can take home today?
So if I may, there's perhaps two. So one would be that we
Please
need
go
to look
ahead.
at how we make sure that migrants can have access to the kind of services they need when they need it. So especially people who are in particularly vulnerable situations, it's not enough anymore for us to say, no, they can't access the service, especially when people are stuck, especially when people can't go home or when they can't actually work and provide an income. So how do we make sure that migrants can have access to the support they need when they need it? And then the second one I would say is that we just need to listen. So we don't have all the answers, but if you read a lot of the quotes in the report, if you look at a lot of the case studies on the website, if we listen to migrant voices themselves, they'll let us know how we can do it better in a more dignified, in a more sustainable way, making sure we're supporting them where they need the support most.
That's a good point. Listen. That's what resonated with me, that word listen to migrant voices. Thank you so much, Vicky, and thereby wrapping up our Red Talk for today. So thank you, Seema. Thank you, Ishi. Thank you to the three of you from different parts of the world. I'm sorry that Nora from the Philippines was unable to join us. I'm sure she would regret not joining us at all. Thank you so much, guys. I hope you've had a really good discussion with me. And for the rest of you who stayed with us this 36 minutes, thank you so much. I hope that you found this discussion insightful as I did. And if you have any more questions, do drop it into the comments on Twitter and LinkedIn, IFRC main page. And then we, the rest of us can discuss or answer your questions. Thank you so much, everybody, and good afternoon, good evening, and goodbye.